Okay.
Welcome, everyone. I'm Tom Friedland. I'm president of the Berkeley City Club. I'd like to welcome all members of the club who have joined us this evening, and I'd like to turn my attention to any Bay Area residents who are not members of the club and invite you to join the club. If you aren't familiar with the Berkeley City Club, we have one of the best restaurants in town at Julia's. We have a hotel. We have a swimming pool, which is one of the more popular attractions for our members. And we're about to open an exercise room. We normally have access to the recreational sports facility on campus, but the campus hasn't yet opened it to non-university people. So we're waiting for them to re-welcome us back at the recreational sports facility. But meanwhile, either next week or the following week, we're going to open a small gym at the club. So if you are interested in becoming a member, please contact the front desk, or if you want to send me an email, I welcome that. And with that, I'm going to turn the microphone over to my wife, Sandy, who's in charge of the evening's program.
Hi. Tom should also have said that the City Club restaurant is open to the public, and they have curbside pickup, and the club is doing the best it can to abide by the quickly changing regulations for COVID safety. So now to the evening's main event. Yesterday, for the first time in more than a year, I volunteered at the Alameda County Community Food Bank, along with 12 members of my hiking group and about 20 other volunteers. We bagged loose carrots and plums, and not just a few. At the end of our shift, we had packed 7,500 pounds of food that soon would be trucked to food pantries around the county. And as you will hear in a few minutes, that 7,500 pounds is just a rounding error once you start talking about how much food this phenomenal agency distributes. We've all heard about the need to feed the hungry and how pervasive food insecurity is, even where we might least expect it, like on the UC campus. We've seen the barrels for donating canned goods and probably responded yes when we are in a checkout line and are asked if we'd like to add $1 to our tab to feed the hungry. But until I actually saw this food bank, I couldn't begin to comprehend how many people need access to free food and what an enormous, impressive, and efficient organization the food bank is. And thank goodness, because during the pandemic, the demand for food assistance doubled, and the food bank has managed to meet that need. But you don't have to take my word for it. We are so fortunate tonight to have Anjali Englund as our speaker. She's the manager of leadership gifts at the food bank and a terrific ambassador for it. She'll explain just how the organization ramped up its operations to distribute nearly 6 million pounds of food a month. She'll also explain how the food bank, one of the largest in the country, has long played a vital role, not only by fighting hunger and poor nutrition, but also by trying to eliminate their causes. I feel like I knew Anjali even before I actually met her, because her parents are dear friends of ours. They moved to Berkeley years before Anjali did, but I had heard about her work at an organization in Seattle that helped disadvantaged people, mostly women, start small businesses. Anjali's mother, Kay, is a former teacher who has long been involved in local efforts to fight food insecurity. When Anjali and her husband were considering moving to the Bay Area 4 years ago, Kay knew that Anjali had volunteered at the food banks in both Seattle and Bellingham, Washington. Kay recalls telling her daughter, "I've got just the place for you to work." Anjali nailed a remote interview, and the rest is history. In LinkedIn speak, Anjali's profile describes her as a mission-driven development professional with a strong history of accomplishments in the nonprofit sector, experienced in nonprofit management, fundraising, marketing, communications, program development, public speaking. Yes, she's all that, but much more. She's a selfless, community-minded, dedicated professional who apparently was clear about her values long ago. When she and her older sister, Erica, who now is a Berkeley public school teacher, were in high school, Their father, a social worker, used to talk to them about their futures. One day, he advised Anjali to consider a career in finance or business or something, he said, where, quote, you could make some decent money, unlike us. No, Dad, I don't think so, she answered. I just want to help as many people as possible. So it's my pleasure to introduce the very fine adult version of that teenager who in college majored in social change, human services, and American cultural studies, and actually is fulfilling that youthful goal to help others. So Anjali, turn your camera on, and we're so happy to have you here. And if anyone has questions you want to ask Anjali after you hear her or while you're listening, you can put those questions in the chat function. And at the end of her talk, I will ask her your questions. Okay, you're on.
All right, well, thank you so much for that warm introduction, Sandy. Can you all see my screen? Can you see the slide?
Yes.
All right, I'm seeing some head nods. Great. So tonight I have a few different topics that I would like to cover. I'm going to start with some history and then talk a little bit about the before times, the pre-COVID days at the food bank, and then really go into our response and our plans for eradicating hunger in Alameda County. And then we'll end with ways that you can help, and there'll be lots of time at the end for questions. So I want to start by giving credit where credit is due, and that is to the origins of the food bank and arguably hunger relief programs in the United States, and that is the Black Panther Party. Many of you may be familiar with the free breakfast program that they offered for children. That program has roots in our community. In 1969, the Black Panthers began serving free breakfasts at 27th and West Street in Oakland at St. Augustine's Church, which is in the picture on the slide. And they started serving breakfast because they knew that children would succeed in school if they had a full stomach to start the day and start learning on. And at that time, there was a limited program for lunches at school that were reduced price, but even that reduced price was out of reach for many families, and breakfasts were only offered in rural areas of the United States. So that program that the Panthers started here in the Bay Area in Oakland, by 1971, it had really expanded to 36 cities across the country, and it grew to include groceries. And they were providing more meals than the state of California and many other states combined. Well, this program kind of caught the attention of J. Edgar Hoover, and many of you may be familiar with COINTELPRO, which basically grew out of the fact that J. Edgar Hoover called the Panthers, and specifically their free breakfast program, the greatest threat to the internal security of the country. And so that program through COINTELPRO was undermined, and the Panthers and subsequently their meal programs were closed, leaving a really huge gap. So there was lots of people in the East Bay and in cities across the country who had been relying on those groceries and those free meals who didn't have them after the Panthers went away. So what happened is a lot of food pantries and soup kitchens cropped up in some of the same locations where the Panthers had distributed food, and that was true here in Oakland. So in 1985, there were a group of soup kitchens and meal pantries and community leaders who kind of came together and said, we need to fill this gap, and we need to access some of the federal commodity programs and federal resources and buy in bulk. So they're who founded the Alameda County Community Food Bank. So that's how we got started. And today we're one of the largest food banks in the country. There's a network called Feeding America, which is kind of a consortium of food banks, and we're one of 200. So the causes of hunger are very complex, and it's more than just lack of food. We know that there's enough food in the United States to feed everyone. There's also a lot of food that is going to waste and not going to people. But we know that there are more factors involved. There's a lot of social and economic barriers related to poverty and racism, and those are really disrupting that equitable distribution of food. We also know that the Bay Area is a very expensive place to live, and that's contributing to high rates of hunger. So for some numbers, for some context, and again, this is pre-COVID numbers, but In Alameda County, local figures indicate that a family of four needs $96,000 a year to meet basic needs. And that would take two people who are working at $15 an hour. It would take them 62 hours a week to be working to make that amount of money. So it leaves a lot of people in a tough place. A lot of people are too poor to afford food and too rich to get help. The federal poverty level, which is the income threshold for a lot of public assistance programs, is only $24,000 a year for a family of four. So there's a huge gap between that $96,000 a year it costs to live here and the $24,000 a year that it takes to be eligible for a lot of public assistance programs. We also know that hunger and poverty disproportionately impact people of color. And you'll hear the term food insecurity. Sandy mentioned it in her introduction. That is a national measure that's used to define people who are hungry. And it is put together based on a set of questions. It's an index. And just to give you an idea of kind of how people come up with that number, some of the questions are things like, in the last 12 months, did you or other adults in your household ever not eat for a full day because there wasn't enough money for food? Another question, which just breaks my heart, is in the last 12 months, did you ever cut the size of your children's meals because there wasn't enough money for food? So unfortunately, with all the resources we have in the United States, we're at a situation where a lot of people are answering yes, answering often to these questions. So we know that hunger has deep roots. There's a lot of historic practices that were inequitable that really correlate to hunger today. And one example is racially exclusive housing practices of the 1930s, known as redlining. So you can see in these maps on the slide, the top map is a residential security grade map. So essentially a federal agency, the Homeowners Land Corporation, mapped out perceived risk of mortgage loans for residential properties. So the lowest grade, grade D, was colored red, and that's where that redlining term came from. The bottom map is today's food insecurity rates in Alameda County, and you can see that food insecurity rates for neighborhoods still follow a lot of that same lines as the residential security grade maps. So grade A, which was considered the least risky area, right now has a 12% food insecurity grade compared to grade D, which is now 32%. So really the past is prologue here when you're looking at the correlation between past policies and food insecurity today. So I mentioned the before times, so before COVID, and we were busy before COVID. We were serving 1 in 5 people in Alameda County with about 20 million pounds of food a year. And we were getting that out through a network of partner agencies. How people access that food is they gave us a call on our emergency food helpline, and we had staff and volunteers who would connect them to a hot meal or grocery delivery or food bank near them. We also provided nutrition education, so we helped people learn how to cook different foods that we offered, and that nutrition education was at schools, community centers. It was to providers as well as food recipients. And advocacy is something that really sets our food bank apart. We were the first food bank in the country to have an advocacy department, and we're working a lot on policies related to school meals, access to CalFresh, which is the program formerly known as food stamps, advocating for the Farm Bill. And we did all of this with a staff team before COVID of 95. And we also had a lot of volunteers. So you can see Sandy and my mom and some other folks in the picture below. So the 17,000 volunteers pre-COVID equated to the hours of 52 full-time employees. And we had 95 staff pre-COVID. So a lot of labor came from our great group of volunteers. So when a lot of people think about food banks and where we get our food, they think of the food drive barrels that you may see at the grocery store. Berkeley Bowl has them, Star Grocery, they're all over the place. But really the majority of our food is purchased, and it's purchased through a network of food banks called California Association of Food Banks. And we get a discounted rate by buying in bulk. And the average price before COVID was about 65 cents a pound. That was for all food, including dairy, whole grains, eggs, etc. And the average price for produce pre-COVID was 16 cents a pound. So how this food gets out to the community is through our partner agency network. So we pre-COVID had about 300 partners throughout the county, and ACCFB was the hub of this network, and we remain the hub today. So food from our warehouse was loaded up on trucks, like you can see in the picture, and then it was brought to partner agencies. You can see one of our staff members unloading pallets of food. Another option, some agencies like to shop for the food themselves, so we kind of had a mini Costco in our warehouse, our community market, so you can see that picture where folks are picking up food. And again, it's a wide variety of sites: soup kitchens, meal programs, community centers, senior centers, and most of the partner agencies are either entirely run by volunteers or maybe have one or two staff members and the rest volunteers. So something that we did recently in the last couple of years was start a new model called redistribution organizations. So having satellite hubs across the county so that they acted kind of like mini food banks. And the first one of these redistribution organizations is the Berkeley Food Network. So some of you may be familiar and maybe even have volunteered with them. So they're an independent organization, but we helped get them off the ground. So we did some fundraising, and some consulting in terms of getting them going and launching their site on 9th and University. And they now case manage a lot of our Berkeley sites and do safety and compliance visits. And they're working their way up to being the lead for all of the Berkeley sites. We're also in the process of getting another redistribution organization started in Hayward. So we have lots of partner agencies in Berkeley. There's over 30, and some have multiple locations. City Club people may be familiar with St. Mark's Episcopal Church. They're your neighbor right on Bancroft Way, and they have a hot meal program on the third Saturday of the month. So you may have seen folks lined up to get the meal there. So folks from St. Mark's are coming to the food bank to shop for food, or they're getting those deliveries. So the product that they're turning into meals is coming through our food bank. Pre-COVID, the best practice for food distribution was called client choice. So we would try to make the experience as close to going to the grocery store as possible and allow people to pick out what foods they wanted. This often involved waiting in line and being in close contact with other individuals, and also a lot of touching the food, just like you and I do, feeling the tomato, seeing if it's ripe. No two distributions look alike, but this picture shows some of our sites. So you can see going clockwise, the Berkeley Food Network at an outdoor distribution, Street Level Health, which is in Oakland inside of a church, a mobile pantry. We, in areas where there's service gaps where we don't have a partner agency, we have our own mobile food bank. So that's what that picture is in the bottom right. And then a site at a school. So Las Positas College, we have a pantry there. We help support a pantry at Cal as well, which is very busy. And a lot of people are surprised to learn that there's very high rates of food insecurity. It's about 40% in the UC system. So a lot of students need access to food as well. Our organization regularly prepares for and responds to emergencies. We have a mutual aid agreement, meaning we help other food banks out in times of need. So you can see a picture here. After the campfire, we sent staff, and we also sent food and water up to that area. And we sent staff so that the staff of the Redwood Empire Food Bank, they needed to attend to their own needs after that disaster. But our staff knew how to run a distribution and run a warehouse, so we shared that people power with them. You can see in the other picture volunteers preparing emergency food bags. During the 35-day government shutdown in 2019, we stepped in to support federal employees who were working but not receiving a paycheck by providing bags of groceries. And we were serving about 1,200 households a week through that program. We thought that was a pretty heavy lift at the time, and we were unaware that it was going to pale in comparison to what was to come. So COVID was a game changer for the food bank, as it was for all of us. we overnight saw a huge change in pretty much every aspect of our operations, and we were able to get a lot of programming up and running really quickly. We started, in the first 4 months, a lot of the programs that are still in operation got going. So in March, we really saw a huge tidal wave of need. We saw that calls to our helpline increased 1,000%. So we knew we needed to really ramp up our efforts to help people who are reaching out. We were in close communication with the county, with their incident command system, in terms of planning the county-wide response and assessing community needs. At that time, we didn't know how COVID was transmitted, and so we had to really rethink those close contact distributions and come up with new models such as drive-throughs. And more than half of our staff, in the midst of everything that was changing, more than half of our staff transitioned to working remotely at that time. And we implemented hazard pay and some additional benefits for the staff who were on site. And we continued, throughout April, reimagining food distribution. We had partnerships established with 12 school districts. So we were able to provide bags of groceries so that families who had their kids home from school had some extra food. And we started doing a lot to shift our volunteer operations to Alameda County emergency response workers and Conservation Corps workers, because we couldn't have all those 17,000 unique bodies in and out. That'd be kind of a contact tracer's nightmare. So we wanted to limit the number of people at the food bank and shift to different workers. Moving into May, we had to get more partners on board. A lot of our partners closed after COVID because they were worried about safety, or their volunteers were seniors and were in vulnerable groups. So we got some new partners on board to distribute food. We gave capacity building grants so that our sites could have refrigeration or trucks or pallet jacks to be able to meet demand. And then we had a unique program with Alameda County Department of Public Health, where if their contact tracing team identified someone with COVID, we were able to get groceries home delivered to that individual or that family so that they weren't going out to get food and therefore exposing other people. So we continued to kind of go all hands on deck, and then into June, so the wheels didn't fall off, we had to make some infrastructure upgrades because things had just expanded so much in terms of service levels. So the initial impact was much like a natural disaster, but it continues to persist like the worst of recessions. And just like we saw in the shutdown, in the government shutdown and in the last recession, even a small disruption, one missed paycheck, can really be a tipping point for folks and push them into poverty and experiencing hunger. And by a couple months into the pandemic, we had gone from 1 in 5 people in Alameda County experiencing food insecurity to 1 in 4. And that's where it remains to this day. So we're still seeing a big need. This slide here has some photos and stories of some of the people who we've served. You can see in the top left, there's Joe and his family. He said the food helps a lot because it means we get to eat. So you can see that difference that it makes. He was in construction and he was laid off, and so money was really tight during the pandemic. The photo in the top right is Jules, who worked for a surgeon in Oakland, and she was able to go to one of our partner sites on her lunch break to pick up food for herself and her mother. And it was the first time either of them had accessed a food bank, but her mom was 84 and had stage 3 lung cancer, and so was really scared to go out. So it was really a blessing that Jules could access that food and share it with her mom. Danielle, who's in the bottom right, she said having the food pantry available is amazing, and she was trying the best she could, and it really helped out. And she is a mom. She loved playing with her daughter. She loved the extra time to play with her daughter, but the downside of that was she was laid off. She was a special education aide at school and was laid off when COVID hit. So it was really helpful to have that extra food. Also, her daughter was a cancer survivor and so was immune compromised. So again, just taking the pressure off, getting that food at a contact-free site for the health and safety of herself and her daughter. And Christina is another person who came to the food bank for the first time. She had been working in manufacturing and lost her job when her manufacturing company shut down due to COVID. So a few of the faces of folks that we've served with the help of our community. So food sourcing is another area that really changed due to COVID. Over the course of the fiscal year, we're going to see an 80% increase in operational costs, so about $18 million. And part of that is because some of our food sourcing was put on hold due to resource constraints or due to safety concerns. We also were impacted by the supply chain issues that you and I saw at the grocery store. Some of the items that we buy in bulk, things like tuna and beans and rice, cost 40 to 75% more. So costs really went up, and that, when we're talking millions of pounds, added up quickly. We also noticed that the shift from the client choice model to prepackaged emergency bags changed the type of food that we needed to buy. We were able to maintain our nutrition standards. 96% of the food that we distributed in the last year was rated in the highest category of the NutriMeasure index we use for our food. But it did change in terms of the specific things we were giving out. So all in all, in the last fiscal year that ended on June 30th, we spent $17 million just on food. So it's a lot of money, and the average cost was 91 cents a pound, so quite a bit higher than pre-COVID. You can see in this picture some of the produce that we give out. It's about 40% of what we distribute. You can also see these boxes. These are the Coronavirus Food Assistance Program boxes. So these were the federal boxes that we received. It was a kind of a dual effort to give farmers some business and give families impacted by COVID food. So we gave out lots of these boxes. These were also the controversial boxes that you may have heard of, that there was a Trump letter put inside the boxes right before the election. So that was part of our world as well during the pre-election time. So this source of food is going to be ending pretty soon, and we're anticipating we're going to need to purchase a lot more food, going from purchasing about 40% of the food to about 60% when this source goes away soon. So over the course of the last year, we distributed 58 million pounds of food. It was by far the highest poundage in our history of 36 years. Even in the past 4 years, that's a huge increase. When I started 4 years ago, a big, huge goal for us was 20 million pounds, and we're already at 50 million pounds. So it's pretty unprecedented. And we're still seeing record demand for food. This last March 2021 was our busiest distribution month ever, with over 6 million pounds. So it's still, the pace is still really, really fast. Some of the pictures here, you can see the home delivery box that I mentioned. You can see some of the emergency bags that people are giving out. And then I talked about some capacity building grants, so some money we gave to agencies to get important infrastructure upgrades. So you can see Shiloh Mercy House, we helped them get refrigeration. Tri-City Development, we helped them get a van so they could pick up food and do some food recovery in their area. So one of our biggest changes in distribution was the implementation of drive-through sites. So this is our Oakport site. It was actually right across the street from where the vaccination site was at the Coliseum. So it was interesting to have those two unprecedented efforts side by side. And this Oakport site is still in operation. So how it works is we drop off food in the morning. It's just a few blocks away from our warehouse on Edgewater Drive near the Oakland Airport. So we drop off the food, and then volunteers, like the picture with the broccoli, they sort through the produce and get it ready to distribute. And then guests drive up in their vehicle and pop their trunk, and we fill it with food. And it's about 70 pounds of food per household. We've received some really great feedback from this model. A lot of people have told us that they appreciate the anonymity of being in their car and having their mask on. So some people who maybe experience stigma, waiting in line in a public spot, that kept them from going, are now feeling comfortable with this model. We've also seen, and we encourage people to pick up for their friends and their neighbors. So that's happening a lot more. So there's fewer cars, but there's still the same volume of food going out through that site. And before we go any further, I just wanted to make sure to highlight our amazing warehouse staff. We have a fabulous operations team who have been on site this entire time. So these are some of the folks. So big thank you to all of these people. So the need is ongoing, as I mentioned. We're still seeing food insecurity at about 30% in many areas of Alameda County. We're anticipating another spike in demand with the Delta variant, and also with the Delta variant, and then aid programs potentially sunsetting. I'm just seeing a question about screening people in terms of, there's a food insecurity screening to kind of determine rates of need across the county, but at the specific site, really our motto is to answer, not question the need. So if someone's going to go through the effort of showing up at the site and they need food, we're going to give it to them. So this map again is showing food insecurity rates. Unemployment has declined slightly, but there have been 5 million people who have left the workforce since COVID who are not counted in unemployment numbers. So a lot of need that's persisting. We, in addition to the unknown about Delta variant and the extension of different COVID relief programs, we're seeing a cliff in California with rent debt. So California leads the nation in rent debt, and you can see how rent adds up with the median price of a 1-bedroom being $2,300 in our area. That can get really, really high quickly, the amount of rent debt. So we know that we're not going to be able to end hunger through food distribution alone. We've more than doubled distribution in the past year, and it hasn't come close to ending hunger. And we also know that a strong economy that we have in California and in Alameda County hasn't translated to local food insecurity rates going down. It's just tough to make ends meet. You can have a really good job here and still be below the poverty line and still be struggling to meet basic needs. So at the food bank, our mission is to passionately pursue a hunger-free community. And when we're talking about that, we're talking about eradicating hunger, and really by eradicating hunger, pulling it up by the roots. So we're thinking about, what are those root causes, and asking ourselves some big questions, such as why does hunger exist? Poverty and racism, we know are causes of hunger, and we're working to educate our staff and our supporters on root causes. We talk a lot at the food bank about how hunger is eradicated, and we believe that's through the redistribution of power and resources. So we try to bring voices to the table, have representation from those who receive food, those who are part of our partner agencies, on our board, at programming decision-making tables. We think about where we spend our money and trying to invest that huge food purchasing budget, that $17 million last year, try to invest that in Black and brown farmers and support the local economy, support local businesses as well. We're also thinking about what is the role of the food bank in eradicating hunger. So we know that distribution is going to be our core business, but we also need to focus on policy and advocacy. And that's because it's been 50 years of this food banking model in the United States, and hunger has not gone away. In fact, it's really increased. So we know we're going to need to think of outside of the box of distribution alone, and also think about how do we measure success. Traditionally for food banks, it's just been pounds, but really it's more than just pounds. It's thinking about, are we changing people's lives? Are we helping them thrive? Moving forward, so there's lots of things that we have on the horizon moving forward. A huge piece is infrastructure upgrades. So I see a question about donations of meat and fish and distributing it and keeping it fresh. So that ties right in with infrastructure upgrades. Right now we have a cooler that's 5,000 square feet, and it is packed every day. It's like a Rubik's Cube, moving things around. So you can see the picture below of the warehouse of the future construction timeline. we're undergoing a massive renovation of our warehouse, and we're adding 2 additional coolers. So we'll have more space to keep fresh product like meat and fish and produce and dairy in our warehouse. So that's a really big focus, doing infrastructure upgrades, and not only at our site at 7900 Edgewater, but also for our partner agencies. So we're doing that. We're doing more food recovery. So that's going to bring more fresh food in. And that's in conjunction with some legislation to reduce edible food waste. So lots on the horizon of what we're going to do. But really what I want to make sure that I share with you is that we need your help in order to keep up this pace and continue to serve at really record-breaking levels every day. We love volunteers. We need more volunteers. We have a lot of safety protocols in place, temperature checks and different health screenings to make sure that we're keeping our volunteers safe. So our biggest need is people who can commit to volunteering once a week for at least a month. If an episodic shift works better for you as an individual or as a group, we can accommodate that as well. If you're not into lifting giant bags of onions like some of the pictures below, we have some more low impact volunteer opportunities on our helpline, so people can answer calls and connect people with food. And if you want to do something in Berkeley, we can help connect you to our Berkeley partner agencies. There's a lot of needs you can see listed there from our Berkeley partner agencies. We also need people to support us financially. We are really grateful for the outpouring of support we've seen in the last year, but it's starting to plateau, and donations are plateauing, but need is continuing to increase. So we're going to need folks to continue to support us. We've had some creative donations, like people directing their stimulus checks to the food bank. A lot of people have been sharing gains from stocks and mutual fund shares with the food bank. So financial support is a big need, and that helps us get a lot of that food that I talked about that we purchase. And advocacy, we have a whole team of advocates you can see in the picture. Pre-COVID, we went to Sacramento. These days we do calls over Zoom, like the picture of us with Buffy Wicks. So if you're interested in getting involved in advocacy, I'll share some resources as well. And we're having another virtual coffee discussion with our Director of Policy and Partnerships in a couple of weeks that you're welcome to join. So I will share, as we open up the floor for discussion, I'll share some of these resources to help people get food. We have some great videos that unfortunately don't work too well over Zoom, but you can watch them on your own time. So I'll share those as well, and then more details about policy and volunteering. So I'll drop these links in the chat in a second. And I just want to close with this nice picture of some kids who came to a distribution with these signs that they made. And I don't know if you can see, but the bottom sign, it says, "Thank you, ACCFB, for feeding our tummies." So that just kind of makes my day and reminds us why it is that we do this work. So thank you so much for listening. And I will open up the floor to questions, and Sandy can help facilitate that process.
Yeah, if you have a question, please put it in the chat. I also, let me turn my camera on. I also want to let those of you who are here know that we've been recording this session. And if you have friends or family or neighbors who think might be interested in hearing Anjali's unbelievably informative talk, you can email me if you know me, berkeleywalker@gmail. I'll put that in the chat. Or you can get in touch with the City Club, and we will make sure that you get the link to this program. I'm not sure we have any questions. Anjali, I have a question. Can you talk a little bit more about how you get that $17 million a year budget? Where does that money come from?
Yeah, so the majority of our funds come from individuals. We have a really generous community and a lot of people donate. So that's where the vast majority of our funds come from, is individual contributed revenue. We receive some government funding and some grants from corporations and foundations. But again, most is from individuals. And I do see a question I can kind of add to this in terms of largest in the country. So the Feeding America network of 200 food banks, the food banks all have different territories. Some food banks just serve a city. So for example, New York City, they're just serving New York City. They're not serving an entire county like we are. Some food banks in areas like Wisconsin are serving half the state. So it's a little bit different. We're all kind of put in categories or cohorts based on the size. And the size is not only service area, it's also our budget, and it's the amount of pounds that we distribute. So hopefully that answers your question.
Can you tell us a little bit about, you shared this with me when I spoke to you earlier about soda?
Yeah. So nutrition is really important to us at the food bank, and we actually were the first food bank in the country to stop distributing soda, and that was in 2005. And that was because it's not helping anyone's health. So we were getting about 1 million pounds a year of soda, and our executive director said, "Why are we doing this? A lot of the people we serve are suffering from diabetes and other nutrition, related illnesses. Let's stop." And one of the questions from our board was, how are we going to replace the pounds? Because that's such a key success metric of food banks is pounds, right? So she said, well, what if we replace it with produce? And that was a pretty bold step. Not only because we had to go to some of our corporate sponsors and say, we don't want the blue soda, we want bottled water that we can use for people who are unhoused. And also we had to shift to buying more expensive produce in lieu of things like free soda, but we thought it was a risk worth taking, and a lot of food banks in the country followed suit.
And I saw them because I was there yesterday, but can you just review, you mentioned temperature checks and things, but what else is going on at the food bank to make volunteers feel safe and more comfortable?
Yeah, well, we are getting information about vaccines of staff. And we have about 86% of people we have of staff are verified vaccinated. And then there's other people who we haven't kind of connected with them over Zoom to see their physical card, but they've reported that they're vaccinated. So we have much higher vaccination rates than the general population. We're also ensuring distancing. So there's a safety orientation at the beginning of every volunteer shift to remind people of keeping social distance. How people are staged in the warehouse, kind of where they're standing, is at a safe distance, and we're encouraging masks. That's a requirement inside, and frequent hand washing, and we're doing more frequent cleaning of the food bank. So lots of safety protocols.
Plus, you've got enormous and somewhat noisy fans running.
Yeah. And there's probably things that that I don't, because I'm one of the 50% of staff who's been working remotely since March 2020. So I haven't seen some of these.
Well, I'll just say they did a terrific job during that orientation that you mentioned, and making sure that we were all being extremely careful and comfortable with what we were doing. You mentioned that, well, I mentioned too, that we were bagging food, but there were also jobs for people to do that were not so physically taxing in the warehouse itself, that still were involved with the food.
Yeah. So you might have seen in some of my pictures of food, bags of produce in mesh bags. So we have a seated station in the warehouse where volunteers are. It's essentially a huge roll of that fabric, and they're cutting it and tying it. So some people are part of the action in the warehouse, seated, doing that. We have some repacking, and sometimes that can be done seated. So, putting rice or beans into a plastic bag from a huge container. So there's some things there. And then there's a lot of volunteer opportunities that can be done remotely related to advocacy. So there's phone calls. We did a lot of work around the census in terms of helping people fill that out and encouraging people to complete it. So those kinds of jobs can be done from anywhere, regardless of ability.
Right. There aren't, unfortunately, as many people here as we were hoping to have, but we will distribute this tape widely. But if any of you want to unmute and ask Anjali a question before we say goodnight, please feel free to do that. Anyone? Okay, well, I learned a lot, and you are, just what I said, a fabulous ambassador, very clear, and your slides are So it's a great presentation. Thank you. And really, we thank you for your service, which sounds like a trite thing to say, but now we know exactly what's involved and what you do. And I should add that Anjali is really good at asking for money, which for donations, which not everybody wants to sign on to do. And that's her job, to go and solicit donations from big corporate sponsors and smaller ones. And that's a behind the scene job that makes it possible for this agency to exist. So we thank you for that, as well as for the presentation tonight.
You're welcome. Well, thanks so much. And get in touch. People can reach out to me anytime. And also, we'd love to see you as volunteers.
Right. Thank you. Good night, everyone.